It's obviously not a long journey. I haven't flown from South Africa. I do live in Goa for 5 months of the year, and then Cape Town for the rest of the year. So probably two of the more, I know you here in Karnataka might disagree, but in Goa and Cape Town I have two of the best destinations to live in. So I am a bit smarter than I look, right? So please, you guys, don't be fooled by what you see. You can't judge a book by its cover. But no, it's been amazing, because a bit like I burst onto the scene, no one had heard about fielding. It's a bit like what you're doing now with regards to the speciality around epilepsy treatment. For a long time, when I was growing up as a small boy in South Africa, there was not a lot known about epilepsy. I was just really fortunate, because my parents were both teachers, and they understood how mean and nasty peers can be if they perceive that one of their classmates or age group is different in a way. And they were very, very supportive and very positive in understanding for me that once I knew my limitations, then I could overcome them. And the irony, the crazy thing is that my father was a rugby player. Now rugby is a sport, high contact sport. So I was never allowed to play rugby, because I was diagnosed in age 6 or 7 with reflexive, a mild form of epilepsy, and it meant I could not participate in this sport called rugby. So I couldn't follow in my father's footsteps. But fortunately, it drove me, because in the schools that I grew up in, you had to play winter sport. So summer we played cricket, winter we had to play either rugby, football or hockey. So I could not play rugby. So it drove me to football and it drove me to hockey. And the irony of that is that even though I couldn't be like my father, it turned me into I was going to say the best fielder in the world, but the only fielder in the world. Because nobody else was fielding, right? People were putting a foot down, maybe calling the ball boy, throw the ball back. I mean, the Indian team in the 90s didn't even run to the boundary. So it was easy for me to be the number one, but all the fielding, because we didn't have a fielding coach. So all the lessons that I learned in the field were from football, were from hockey, from tennis as well. So it's, for me, when I look back on my career, I'm not thankful for the epilepsy. I'm thankful for my parents and their understanding of the situation. Even though medically not a lot was known. This is now early 70s. So I'm a 69 born boy, giving away my age. And 75, 76, 1975, 76, not a lot was known about epilepsy in South Africa, and I think on a global scale. So my parents could have done what most of us parents do, where we look to protect our children and say, well, it's too dangerous, you can't do this, you can't do that, too much risk. And they were adamant from the beginning that as long as you don't play rugby, you can do anything else. To the extent that when cricket with a hard ball, I was the only kid in South Africa wearing a helmet. No other kid wore a helmet. Now there's obviously regulations and rules when you play hardball cricket in South Africa. I'm not too sure if the same applies in India. Kids have to wear a helmet. They had to bring a helmet from England. There was no helmet in South Africa for schoolboys. So really grateful that the support my parents gave me, the understanding that they had of the situation, because that's a large part of the biggest issue with epilepsy. And it's amazing to hear the advancements in medicine, the advancements in surgery, neuromodulation, which is not invasive, but it's more around the nerves and training the brain. I mean, I'm a coach. I like to think that we can train people, and the brain is such an important part of cricket. We know that a lot of the game, especially 5 days of test cricket, can we talk about test matches? A lot of that happens in the brain, right? It's not just the cricketing skills. So it's amazing to see the advancements that is happening on the medical front. But I think it's still a large part. What has been left behind is the awareness and the stigma that's still attached to people with a condition. It's not an illness, it's not a disease, it's a condition that is treatable, that can allow people to lead a normal life, as long as it's diagnosed early and it's treated. And I think that is, for me, one of the major reasons why, I'm not somebody that gives a great deal back to charity because there's so many deserving charities around, whether I'm in South Africa or in India. But this is one that's really close to my heart, because without my parents' support, I would have been stuck and boxed as somebody with epilepsy, not as good as, or not capable of achieving something as great as playing cricket for my country, because my parents would have put me aside and said, just for my protection. So I'm really grateful for that support, and it's amazing to see, even with the advancements in medicine and surgery, that we still get together and focus on this very, something that I'm really passionate about, and that's treating or diagnosing and treating epilepsy and making it available for people across India. Because I think, again, a big part of what is happening is that in outlying areas, the cost of getting medicine, the cost of getting treatment, or even taking work or days off to get your child or your relative to be diagnosed or to get treatment, it can be costly towards families. So it's amazing to see that there is this organization that Aster is doing, specializing in epilepsy, because it is something that I feel very strongly about. Thank you very much.
Epilepsy is a condition where people tend to have 2 or more unprovoked seizures. So seizure is nothing but abnormal electrical activity that causes the brain to behave differently. It may in the form like commonest one being in the form that people fall down, have jerking of the limbs. But other types also are there in which people can behave weirdly. They can talk in a different manner. They can see abnormal lights, abnormal feelings. So basically, when people have 2 or more episodes of seizures, then we call epilepsy. So epilepsy, broadly speaking, we can say there are 3 main reasons which are responsible. Some of them have an underlying problem in the brain, which can be seen in a good quality MRI, which may be a problem which has happened to some, in India, most common reason we see is basically some problem at the time of birth, like low sugar or the child having low oxygen levels at the time of birth. This causes brain damage. Apart from that, infection is second most common, and third most common is the road traffic accidents which are responsible. So in this underlying brain damage is there. Other reasons also are responsible for epilepsy. Basically, it can be some brain tumors or it can be some brain developmental problems. These are all reasons in which MRI has a problem which is responsible for epilepsy. And some people, the cause is genetic. In few of them, the family history is there. Like from the one family, the next generation gets the epilepsy. So in this, or in some of them, the patient's own genes can have some mutations without any prior history as well. In this, based on the investigations, we label the cause to be genetic. And few patients, despite investigations, the cause is not found, in which we call idiopathic epilepsy or cryptogenic. So these are the 3 main causes for epilepsy, broadly speaking.
Brain. And that short circuiting produces certain characteristics, like shaking of the hand, froth coming out of the mouth, uprolling of the eyeballs. These are what you commonly know as apasmara or seizures. And that is because of a short circuiting, which happens, which Dr. Avish had given you the whole list of causes for this short circuiting.
I think that the biggest, or hopefully where I can contribute towards what Aster is doing regarding epilepsy in India, is creating awareness that people with the condition, it is treatable. And in my generation as a young boy growing up, the only option was through medication, and even that in itself was a bit of guesswork, and you had to wait until the medicine started taking effect. And fortunately these days, with technology, with the advancement in surgery, options are available. And a big thing, I suppose, that the biggest reason why I've come here today, and it was a last minute request from Aster, is that I'm really amazed by what they are providing for people in India with epilepsy. I didn't have this opportunity as a young player, as a youngster growing up, but I had really supportive parents, a very supportive school. So my teammates, my teachers, they all knew I had epilepsy. So I had that support. And you need more than support, though. You do need technology, the advancements, and a life with reduced or without epilepsy for somebody who has the condition is a life change. So I'm here to try and help that.